Cord.
Hi, you guys. Welcome back. I'm Dr. Molly Sears, and I'm joined by Dr. Mary Ellen Tedeschi and Dr. Shreya Soni. And today we're going to talk to you guys about common myths about the pill. So I believe Dr. Shreya is going to start us off.
All right. So these are some of the top myths that we see in practice with patients coming in with hormonal issues. So some of the top myths that we're going to be talking about are the idea and belief that the pill fixes your period, that the pill doesn't cause weight gain, and that birth control treats acne. So myth number one, this is the top reason that I see girls on the birth control pill is that they think it fixes their period. The pill does not actually give you a period. When you are taking the pill, the 4 days that you have off, it's actually a withdrawal bleed, and we'll talk more about what that means. This is what your hormones do typically across the month. You have estrogen rising up to the time of ovulation, after which progesterone is on the rise. So each of these hormones make you feel differently. When you're on the pill, ovulation is not occurring. You're taking synthetic hormones, and these definitely can help with some of the symptoms, but they don't actually deal with the cause of why you may have hormonal imbalance related conditions. So birth control can be a very useful tool in women's health. It's definitely great. It's great that we have access to this tool. My philosophy is that anyone taking the pill, there should be informed consent. So there are things that I like birth control users to know. So the first thing we already talked about is that you don't actually get your period because the birth control will be inhibiting ovulation and natural reproductive hormone cycling. As a result of that, adolescent girls who are on birth control, because estrogen isn't cycling naturally in their body, they are at risk of reduced bone density. And this is in proportion to how long that they may take the birth control pill. In addition, it's important to know that if the pill you're taking also contains synthetic estrogen, you are at a 5 times higher venous thrombotic risk compared to if you were not taking the pill. So what this means is that if you have a family history or genetics of stroke, it's important to consider that in making your decision about the pill. There are types of the pill you could pick that don't have estrogen that reduce this risk. Other types of genetic testing that is important is factor V Leiden, for example, in which you are at increased risk of clots anyway. So clots can be deadly, and it's important to do a little bit of research before making this decision for you with the pill. And when it comes to your period, the pill is symptom management, it's not treatment. To me, the woman's menstrual cycle is your 5th vital sign. It's your opportunity to see what's going on in your body, underlying conditions. So for example, if someone is bloated in their period or having headaches in their period, that's all information I use in treating the cause, which can be a combination of lifestyle, diet, nutritional interventions. When you're taking the pill, you're not seeing these symptoms anymore. And so you're basically postponing when you may see the cause. The pill is often used as a treatment in endometriosis. There's no trials about whether it's effective for endometriosis, preventing disease progression. It does mask over the symptoms of endometriosis, which is wonderful for those women who are in chronic debilitating pain, because the seriousness of endometriosis should not be downplayed. So it's definitely a very useful tool, but do know that it doesn't necessarily mean that you've treated endometriosis if you're taking the pill. It may mean that there's a delayed risk in diagnosis because you're not seeing the actual underlying period while you're taking the pill. And studies have found about a 2.3% increased risk of receiving an endometriosis diagnosis compared to women who have never been on birth control. This does not mean that the pill causes endometriosis by any means. There's many factors that could play into that, but that is something to keep in mind. Other things are if you have had a family history of gallbladder disease or liver issues like liver cysts, it is important to know that birth control use is very much related to the development of gallbladder disease. We do see an increased risk of gallstones as well as other liver-related complications. So let me just pull that up. So intrahepatic cholestasis, hepatic adenomas, hepatocellular cancer, all of those are possibilities. And then the last thing to know about if you're taking the pill is post-birth control syndrome, which is something that you can experience for up to 4 months after discontinuing the birth control pill. Some women experience things like hair loss, and they do find it's their hormones are off for that period of time. This doesn't mean that you will suffer from birth control pill syndrome indefinitely, but it is something to keep in mind that it occurs for 4 to 5 months. Very rare cases, you do see that women are never the same using the birth control pill. Most often, that's what I'm seeing walk into my office, women who have never been the same since using the birth control pill.
Nice. Thanks, Sherry. Myth number.
Sorry, anything you guys wanted to add to that? Because I know this is a lot of information.
I think it's good to reiterate, looking into an individual's family history of cholesterol issues, hypertension, all of that, because that gives us more of an idea of how much we need to discuss with you the risks that could be more directed in your case. Because Shreya's right, that's a conversation that's not often happening in the patient practitioner setting, is this informed consent. And so I think this slide is a really good resource for you guys, and you should screenshot it. And if you're going to be discussing with your healthcare practitioner about going on the birth control, bring this in and show them, ask some questions about this slide and how you can, be more aware of your individual risks.
Yeah, I completely agree. And I think something that the three of us share is the passion for helping you guys make empowered decisions about your health. So no matter what you're hoping to discuss with your doctor, make sure that you're going in with that knowledge and with the resources that you need to have those important conversations and to make those decisions that are most appropriate for your health.
Yeah, and I think a lot of this data is coming out more now. But while this is emerging, I definitely don't want to create any stigma against women who may be using the pill to help with their menstrual cycles. Again, I do endorse it. It's something that we can prescribe, but I think it's important to know about your increased risk factors so that we can support you with those. There are certain nutritional interventions we may recommend while you're taking the birth control pill to deal with some of the microbiome changes, to deal with some of the liver effects. So there are things we can support you with to handle some of these risks.
The nutrients that are depleted too are an important thing to supplement with. So having a naturopathic doctor, if you're on the birth control pill and looking for some more alternatives or ways to help manage symptoms while you're on it, is a great idea.
Yep. Yeah. Okay. So weight gain and taking the pill. This is something that often women are told there isn't substantial research to say that the pill causes weight gain, but we're going to go over why that's not necessarily accurate. So, clinically, this is something I hear women share with me, is often this concern of weight gain either after starting the pill, coming off of the pill, etc. And it's often disregarded by practitioners, and there's this blame and guilt that gets put back on the woman, which is not great. And so we want to share with you a little bit about that connection between weight gain and the birth control. So if we look at, the thyroid pathway first and foremost, this is where we see that connection predominantly playing a role. So, thyroid is most commonly known for regulating your metabolism, temperature, etc. And all of this can play huge roles in managing your weight. So if we look at this picture, you see the thyroid sits in your neck. And your thyroid's a gland. It releases thyroid hormone. And so those get released as T4 and T3. T4s are inactive and T3s are active. And then in our body, we go on to convert the T4 to T3 at more of a cellular level. And while these are traveling through our body, they exert effects on all of our cells, which is pretty cool. And there's something called thyroid hormone binding globulin. And so in a normal functioning thyroid, the thyroid hormone binding globulin is going to bind to the thyroid hormones to help transport them. And not only are they just transporting them, but they're helping keep the levels balanced in your body. So when this protein is bound to the thyroid hormone, it's basically making it inactive. It's fully functional, but just inactive for the time being. So then if we look at the next slide and we see when we introduce the birth control into the picture, we can see how this pathway gets manipulated a little bit. So first and foremost, when we introduce the birth control, there are studies to support this. We see an increase in thyroid hormone binding globulin, and this is going to bind up a greater amount of our thyroid hormone, which you see by the handcuffs by T4 and T3. And then this is going to have a decreased effect of the thyroid hormone at our cells. So it's going to affect all of those good, positive thyroid, mechanisms that we see. And so that's when we can see this correlation with more weight gain, or even other effects of hypothyroidism. And this is often going to be missed on normal, serum testing of your thyroid, because it's not necessarily a true thyroid issue, right? It's something called functional hypothyroidism. And so, people will start to gain weight, and often their doctor will run a TSH, and the TSH might look normal, and they'll say, no, your thyroid's fine. But there is this other pathway here that's important to consider. And so if we summarize, we see the increase in the thyroid hormone binding globulin, the decrease in thyroid hormone, which leads to the functionally low thyroid function. And the symptoms that we can see with this is, depressed mood, constipation, weight gain, brain fog, dry hair, and skin. So that's my little blurb on weight gain and birth control. Do you guys have anything to add?
Yeah, I mean, they definitely see changes in even the brain. There's certain structures that they've seen smaller in women using birth control pill. So some of those symptoms of depression, it's important to know that might happen if you're taking the birth control pill.
Yeah, and this is all in something called our endocrine system, and so we do see, when our thyroid changes its functioning, we also see the change in our sex hormones, which can also contribute to a lot of these symptoms, and they overlap quite a bit.
Exactly. Great summary, Molly. Thank you. Awesome. And to wrap it up, myth number 3, that the birth control pill treats your acne. So conventionally, the birth control pill is a very, very popular treatment choice to help women with acne. And if they're, really struggling with acne lesions and breakouts that they can't get a handle on, it's very common that they'll go to the doctor for a prescription of birth control because they feel like they've heard great things about how it can clear up your skin. So while that is true that generally if you are on the birth control pill, you will notice a nice side effect of your skin clearing up. This is because the synthetic hormones in the birth control pill, so that estrogen and progestins in the pill, they actually decrease the circulating levels of androgens, so hormones like testosterone, which are usually involved in the proliferation of acne. So when we reduce those circulating levels of androgens, we actually get to encourage the skin to reduce its sebum or oil production, which then helps to resolve acne. But I encourage you guys to really think about, and Shreya, Dr. Soni mentioned this at the beginning too, is this simply just, a symptom management? Sorry, just a sec. Is this simply only symptom management? Is it treating it? And in the case of acne, going on the pill is symptom management, because what we also need to think about are those underlying causes, treating the root cause of why you're getting acne in the first place. So things like PCOS, insulin resistance, other hormonal imbalances, food sensitivities, liver detoxification pathways, dysbiosis, so what's happening in your gut, all of these things can contribute to why you're experiencing acne. So while you might have beautiful skin while you're on the pill, what happens when you get off the pill? Usually a return of that acne. And this is something that we see that called post-birth control syndrome. And I believe we want to do a video on that topic just to give it the focus that it deserves, to talk more about it. But so essentially, once we're taking away that method of helping to control your circulating androgens, when we take that birth control pill away, we're getting a resurgence of that acne if we haven't dug deeper and figured out the root causes as to why you're getting it in the first place.
Yeah.
I loved some of the information on this, and I'll say the pill does change your microbiome. And so often we are supporting women on the pill with different types of probiotics. But yeah, just like you said, you're just postponing the treatment in some ways. So it's really useful. A conversation to have with your doctor is how long you plan to be on the pill.
Mm-hmm.
Yeah, another thing, it's not going to cure everyone's acne, right? Like we're focused on, the androgen reduction when we go on the pill, but just like Dr. Mary Ellen's got all those other causes of acne listed, is not everyone's acne is from an elevated androgen level. So a lot of times people will go on the pill with this hope of their acne, reducing or clearing. And it's kind of an empty promise sometimes if you're not sure that that's what's causing your acne. And if it is what's causing your acne and that's the only reason for going on the pill, there's lots of alternative treatments to naturally reduce your androgen levels.
Exactly. And a lot of assessments to figure out that root cause. We actually did record a video all about acne. So we'll link that if you haven't watched it yet, because we have some great information about what that looks like when you're working with a naturopath.
All right. And we already covered this, but this brings it back to our strategy with hormones, with acne. Like we've talked about, I see your period as your fifth vital sign. I see all of those symptoms as indications of your underlying health. And so while the pill is definitely a useful tool, it's not necessarily, it could be postponing treatment of underlying conditions.
Exactly. And it brings it back to the actual goal of using that birth control pill. If you're genuinely using it for contraception methods or for family planning and things like that, as Dr. Shreya mentioned, it can be a very, very useful tool. But if we're starting to use it for things like acne or symptom management with the period, that's when I encourage you guys to think about taking a deeper look, working with a professional to figure out the root cause and the underlying imbalances that are contributing to those symptoms, to see if you could be better supported in a different way. All right, so that's me, Dr. Mary Ellen Tedeschi. I'm in Ontario, and I do have a clinical focus in women's health and hormones, digestive health, and skincare. I love giving you that glow from the inside out. So if you are looking for a naturopath or would like to connect with me, you can follow me on Instagram at Dr. Mary Ellen, or my website, drmaryellentedeschi.com.
Oh, okay. There's a little delay in changing the slides. This is me. I'm Dr. Shreya Soni. I'm a naturopathic doctor and I practice out in California. And I love helping women experiencing period problems. So this can be fibroids, heavy periods, even prolonged periods, painful periods, and especially helping women deal with some of the causes of endometriosis. So I may look at your gut, I may look at infections in addressing that. My website is dr-soni.com, and you can follow me and ask me what you would like our next webinar to be on at my Instagram handle. So that's at the.endo.doc.
And that's me. I'm Dr. Molly Sears. I am based out of Colorado, and I have a fully telemedicine-based practice. I also have a focus in women's health and all the conditions that come with that, as well as autoimmune and chronic disease, digestive concerns, and then overall wellness and preventative medicine. My website is www.drmollysearsnd.com, and you can see my Instagram and my contact number and email there.
Well, thank you so much, for tuning in today, guys. We hope that we helped to answer some of your questions and those common myths about the birth control pill, giving you some things to think about.
Yeah, and as always, reach out with questions or any other topics you'd like us to discuss.
We'll see you next time.
See you next time.